Many Americans have or have had a bottle of opioid medication in their medicine cabinets, but few realize the potential dangers of getting one of these prescriptions filled. Now, there's a lot of questions like what should you do if you're prescribed an opioid, or what questions should you ask your doctor? So we wanted to learn more. So today we have David Calabrese, the Chief Pharmacy Officer for Optum Rx. David, you're addressing this crisis head on. So let's start from the beginning. How should someone address this with their doctor and start that conversation?
Certainly. The best way to address these type of things with your physician is to simply ask questions. I think many folks today are intimidated to ask their docs questions about, the therapy that doc wishes to initiate. But in today's day and age, good quality healthcare involves informed decision making and informed decisions between the physician and the patient. So never be afraid to ask questions. What is this pain reliever you're about to prescribe for me? Is it an opioid? If it is an opioid, what are some of the risks and how should I take it? Unlike other medications like antibiotics, opioids don't have to be taken for the full duration of therapy, and they can be interspersed with other medications as well to help patients manage pain, particularly short-term acute pain like dental extractions or a sports-related injury.
Now, a lot of times people say, they want opioids to be the last resort if possible. So what are some other medication options that are out there?
Yeah, there are plenty. There are both prescription options and then there are over-the-counter options. Very good over-the-counter options are medications like ibuprofen and naproxen, acetaminophen. These are commonly obtained medications from your local drugstore. Common brands are Advil and Aleve and Tylenol. When dosed appropriately, many studies have shown they can work as effectively as an opioid, again, particularly for these short-term, low to moderate pain type of situations. For more chronic pain, there are also non-medication related alternatives, things like physical therapy, chiropractic care, massage therapy, relaxation techniques. Those are all very good options as alternative to an opioid for longer term use.
Now, we talk a lot about responsibly using opioids, but it's just as important to pay attention to how we dispose of them as well.
Yeah, very important. There were surveys that are done nationally that show that 60% of U.S. households store leftover opioids, oftentimes in unsecured locations throughout the home. So it's important that we take advantage of disposing those as best as possible. At the end of the month, we have National Take Back Day. It's a great time to contact local pharmacies, your local police department, Department of Public Works to try and get rid of those medications safely and properly.
Now, when it comes to finding more information, obviously this is a nationwide conversation, so where can our viewers get more information?
Yeah, there's plenty of great information out there on the web. I often encourage folks to go to the CDC, the DEA, and even our own website at optum.com/opiate epidemic for more information.
All right, lots of great information there. Thank you so much, David.
Thanks for having me this morning.
A special thanks to United Health Group for sponsoring this segment.